To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too fake news. Then don't share. Why not? Go to the right place for Corona news. Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UKAID.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Good evening, everyone, and thank you once again for joining us for a wonderful episode of the Health Talks on Trend Africa TV. My name is Dr. Eunice Cromwell, family nurse practitioner, and I'm excited to bring to you this show this evening. Take a moment and share the feed, and we'll be right back.
Hey, this your girl coming all the way from the US of A, ya baby, aka ya Phantom. And me di feel a bozzing pan and to see one virtue the money how Ghana Mart ada romantic. With me sandy provisions, as I track credit, Emma Ebusia phone and for more Ghana. And one is a www.ghanamart.com. And they would say, boy, a sharp connection. www.ghanamart.com. Let's show more provisions in the credit. Na really Zankasa. I have friend numbers na mo screen na seno. Ghana Mart ye crano.
Royal Black says we are back. Maka. Entertainment and sports. Maka. I say politics. Maka. Royal Black says. Assembly Safwa. Bien assembly Puno. Sane Pia de Kami. Ekome ya Kotokumi. Ekome ya Misegbe. You want love make hanging. Maka. Royal Black says we are back. Maka. All the trending issues. Maka. I say politics. Maka. Entertainment and sports. Maka. RBJ Diaba.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us, and I appreciate you all sharing the feed. Continue to share the feed as we have a very interesting program today. Let's start off by getting to know some of the COVID updates. There's been a lot of new developments in terms of the vaccination and also the city lifting up some restrictions. So we are going to now be joined by Ofori, who always sits on our professional panel. Dr. Edward Ofori is an assistant professor of pharmaceutical sciences at Chicago State University. He is a pharmacist by training. His research focuses on drug discovery of neuropsychiatric disorders, including schizophrenia, depression, and substance abuse. Dr. Ofori, you are once again welcome. Thank you for joining us today. How are you?
I'm doing good. How about yourself?
I'm doing good. Thank you. So tell us what we need to know about the vaccinations. What's going on with our vaccines?
All right. So vaccination is going very well at this point, especially in the United States. So US has been hit really hard with COVID-19, and it looks like we're leading in terms of vaccination as well. I do have something to share. Let me see if I can share with you guys. There we go. Are you able to see my screen?
Yes.
Okay. So if you look at this is the United States, and I'm going to share that of Ghana very soon. So what you see is the number of vaccines worldwide, and if you see that 136 million have been 136 million people in the US have been vaccinated, representing over more than half of the adult population have been vaccinated as well. We also know that about a dozen of the United States, like the individual states, 12 of them have exceeded a 70%, mark that we were setting for the Joe Biden's government trying to get all these people vaccinated before July. I think, or pretty much after Memorial Day, we're looking at almost 12 of those 12 of those states have been vaccinated up to 70%. This is good, but then that's just out of 50 states, right? So there's a push by a lot of governors and people in different parts of the United States to get people vaccinated, including even incentivizing people with lotteries. And I know there's a beer company that has promised beer for people if they get vaccinated. There's a lot of ways to incentivize people to get vaccinated. So you will see that if you look at the data that is coming, you realize that there was a big increase. There's a sharp increase in vaccination, and then now we're in a plateau phase in terms of how many people are getting vaccinated. We are trying to push that, with approving, I think, Pfizer and BioNTech vaccines that are good for children or people of 12 years and above. That has also increased the number of vaccines that we're seeing. Now, in terms of, so looking at this is a good data to look at. If you look at the world numbers, the US numbers were really good, right? And now you see that it's coming down. It's part of the reason why we're saying we're trying to incentivize people to get vaccinated, because the world vaccination is taking over from the US. And even though we've achieved a lot of success, we think we should go in the right direction. If you come to Illinois, we just had a word, I think yesterday or early this morning, that maybe next week, Illinois might move to the phase 5, which is pretty much opening up almost everything. If the number of deaths, number of hospitalization, the number of cases begin to plummet the way we're looking at it at the point. For instance, yesterday, there were only about 8 deaths recorded, and all those 8 people were not vaccinated, which goes to tell you that vaccination is something to help us decrease the number of deaths. So going from there, if I put the same thing and I put Ghana, right? So if I go back and I put our country, our dear country, Ghana, this is what we're seeing. So per number of people vaccinated by 100, we're doing pretty well because our population is small. But if you consider the number of vaccines that have been distributed compared to maybe the whole world, you don't even see our data point, right? The same thing applies to this one. You see that Ghana is in less than 2%. As of now, we're looking about maybe less than 1 million administered. What that goes to tell you that even though we are having low vaccination over there, we don't seem to see a corresponding increase in number of cases. Part of the reason I understand is how they're trying to screen people at the international airport, Kotoka International Airport, trying to make sure that we don't have any cases being imported. These are all ways and measures to curb the numbers down as far as much as possible. In terms of number, like the different vaccines that are coming out, we still have the ones from Johnson & Johnson, AstraZeneca, 5. We have from Pfizer. These are the ones that have been currently been going around. We do have some in the pipeline. Novavax is also working on their protein vaccines as well. So if you ask me in brief, vaccination is going very well. It's just that we're experiencing a lot of plateau in the US. Around the world is picking up as the number of doses keep increasing. And we know that when the number of vaccines go up, cases drop drastically and you're able to open places.
And that's exciting. I did see that on the news that Chicago's planning to open up with the rest of Illinois. So things are going to be open with no capacity. However, they did say we still need to wear our mask on public transportation. I don't know about you, Dr. Ofori, but I'm kind of afraid to leave my mask at home. I'm still wearing, I'm not double masking anymore, but I'm still wearing my mask everywhere. It's scary still.
Yeah, a lot of people are still, even those who are vaccinated, still keep their mask on.
Yeah.
I mean, that's just kind of post-traumatic kind of experience, right? So you're scared of what has happened to people, how all of a sudden, the numbers are plummeting, all right, but then we're still feeling kind of insecure, even though we think the vaccine should protect us, right? I have a deep feeling maybe after Memorial Weekend, if you see the trend in numbers, if you don't have any kind of significant spike in numbers, then, the ordinary person, even though if you back it with data, sometimes they don't understand, will kind of believe that, hey, the vaccines are actually doing the job at this point. So, yeah, you can keep on the mask. That's okay. It can prevent you from allergies and other things. Yeah, I do feel that with time, you get over it and we will begin to take the mask off and feel like, the way pre-COVID, the way we used to feel.
It's definitely part of life. It's like shoes, mask. I always, grab my mask before I leave the house.
Right. Now,
I did see that
you talk about keys, wallets, phone, and then you talk about mask, right? Yeah, it's becoming part of it.
Children are getting vaccinated a lot more than adults. I saw that on Channel 7. They said the percentage of children being vaccinated was a lot better than adults. Why do you think that? Do you think that maybe parents are just more eager to get their kids vaccinated and, wanting them to be more safe than probably all of us?
Correct. So, I mean, you can think a chunk of the U.S. population are children at that age range as well. Okay. So you would think about a multi family, right? You have 5 kids at home, one parent is vaccinated, definitely all those 5 kids might get a vaccine as well. So yes, there's increased. I mean, these parents want their kids to be in school, right? And a lot of these schools are requiring that you have vaccines. So it's not like they are forcing you to do it, but it's just like in a way you're gonna have to encourage people to get vaccinated and be out in school. There's one interesting thing I wanted to share with us. So there's an ongoing effort to get like a vaccine passport, right? Which a lot of airline companies are kind of signing up to it. I don't know how it's gonna really play out, but then very soon certain airlines will give priority to people who are fully vaccinated. The name of that group is IATA. So if they usually encourage people who are like travel a lot, they will give you access to a particular lab to go and have a test or to certify your vaccination, and then you can register on your phone. So when you show that to the person that checks you in, they can verify that you're actually vaccinated. So this is an ongoing thing that is going on now to get people, have a digital way of verifying their vaccination as well. In Chicago, there's a push, especially from the governor and the mayor's office, to have a pass for outdoor events, right? That's not to say that you can't get in if you're not vaccinated. But then, if the function says, hey, we only want vaccinated individuals, then you have to have a pass to get in. So it's coming, but then it might, because there's no law backing it, it might be a little bit tricky to enforce it.
Wow. A lot of good things coming up with the summer. Things are very exciting. I know Lollapalooza is going to be opening, and I saw that they want people to show either their vaccination card or proof that they've been tested and negative before they can enter. So definitely an exciting time, a scary time, but I think that with everyone getting vaccinated, I always encourage everyone. I know that within the Ghanaian community, there are a couple churches working together to get us to have some workshops where we'll be able to more like mass vaccinate. I know you'll definitely be involved in that. So viewers, just keep tuned. If you have any questions or concerns about vaccinations, make sure that you send your questions in for Dr. Ofori to answer. We're going to take a quick break and we'll be right back. Thank you.
It's Hot House exclusive on the beat. It's Hot House exclusive, the hit maker.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call Mobile Doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile Doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us back. Right now, we're going to be introducing our guests. Ghana Medical Relief is a 501c non-for-profit humanitarian organization that delivers healthcare to various villages in Ghana. They work in collaboration with hospitals, churches, and organizations in the United States for supplies and medical equipment that are donated to hospitals and clinics in Ghana. To date, the organization has donated hospital beds, ultrasound machines, examination tables, cardiac defibrillators, operating room equipment, and numerous amounts of medical supplies and medications to many, many different clinics all over Ghana. So tonight, my guest is Dr. Samuel Owusu. He is the founder of the Ghana Medical Relief. He is an obstetrician gynecologist at Gessinger Health System, Grayswood, and Mount Nearterry Medical Center in State College, Pennsylvania. He is currently a staff member of the Gessinger OBGYN residency program in Danville, Pennsylvania, and an adjunct professor in OBGYN for Temple Medical School in Pennsylvania School of Osteopathic Medicine. Acadia University, and King's College. Dr. Owusu is a graduate from New York University and obtained his MD degree from Rutgers College of Medicine and Dentistry in 1997. He completed his OBGYN residency in 2001 at Jersey Shore University Hospital in New Jersey, where he served as the chief resident from 2000 to 2001. He is a board certified OBGYN and a fellow of the American College of Obstetrics and Gynecology, American Medical Association, and the Pennsylvania Society of Medicine. Dr. Owusu is a recipient of several teaching and research awards, including Black Science Award from New York University, Arnold P. Gold Award from the Foundation for Teaching of Humanism, University of Medicine and Dentistry Medical Students Teaching Award, Oregon Outstanding Resident Research Award, New Brunswick School District Award for Excellence. Dr. Owusu's area of interest is in women's health and policy making in third world countries. And we are very excited to have him live with us today. You are more than welcome, Dr. Owusu. How are
Thank
you?
you. Thank you very much. Thank you.
You're welcome. So we're just going to go ahead and dig right in. What exactly is Ghana Medical Relief?
Well, thank you. As you introduced the organization, it is a humanitarian organization. And here in the US, we are registered as a 501c. In Ghana, we are registered as an NGO. And our primary goal is to provide healthcare to communities in Ghana that will otherwise not get any care. We've done a tremendous job collaborating with people from the Ghana Healthcare Services. And what we do every year is we put together volunteers from the US, and these are usually physicians, nurses, and sometimes we have medical students who also want to join us. We've had lawyers and people from different walks of life join us as well. And then we work with healthcare providers and other volunteers in Ghana. And what we do is every year we pick a particular community, we go to that community, we spend time there, and we provide free healthcare to them. So it's a fantastic program. When we started this years ago, I started this with a dentist who is a colleague of mine. I met this gentleman in medical school. He was in dentistry school, Dr. Raxon, and we'll talk about him a little bit more. And so when we were medical students and dental students, we figured, we could really do more than just become doctors. We wanted to create a program where we would be able to go back and sort of improve the life care, the health care of our fellow countrymen and women for that matter. So what we've been doing is, if you come to one of our healthcare events, it's really fantastic. We sort of, if a family comes to one of our events, what we do is we sort of, the children will obviously go see a pediatrician, and mom and dad will start off with, an internist. And if mom needs any additional care, they will probably see a gynecologist. Dad gets to see a urologist. And then, after that, if there's any dental work, we take care of that as well. When this is all done, they end up in the pharmacy and pick up whatever prescriptions they need, all for the bargain price of 0 pesos and 0 cents. And that's a fantastic opportunity. Think about it. There are very few healthcares in this country, systems where you can show up and under one umbrella get such a comprehensive healthcare. We're very proud of the fact that we're able to present and to do put together such a program and present such an opportunity for folks back home. And so it's been a tremendous success. Years ago when we started this project, what we did was we just collected medical supplies and donated them to institutions. And I think you mentioned that in introduction. Tafo Hospital, for instance, was a beneficiary of an operating room table, which they still use. Several institutions got things like hospital beds. We donated hospital beds to several hospitals in the Ashanti region. And then we realized, we could do more than that. Instead of just donating things to hospitals, we figured, why don't we put together a program where we will actually bring in professionals from different walks of life, from different specialties, work with people in the Ghana healthcare system and actually go and take care of people and interact with them and see how best we can, serve them. And that's what we've been doing the last few years. Our first mission was at Siakwa in the Eastern region, and it was a wonderful program. And then we did another program 2 years ago at Anomabu, which was a fantastic program. And I believe that's how you found out about us, because you came to Anomabu ahead of our wonderful program there. It was a fantastic program. We screened over close to 4,000 people. we're able to provide them with obstetric care, gynecologic care, urologic care, pediatric care, and we also had seminars where we sort of taught them about things like hypertension, diabetes, malaria prevention. We also had CPR programs. It was just fantastic. So we are very proud of our program, and this year we are going to Quo up in the mountains, and we hope to do a similar project up there.
Very exciting and very admirable program that you're doing.
Thank you.
And we are so grateful and very happy that we have you here so we can really get down and get people to know about it, get people to register to be volunteers, of course, be able to raise money for your great mission as well. Yeah. So tell me a little bit about your role as the founder. I know you mentioned that it was you and Dr. Roxon, who is a dentist, who put this together. So what exactly is your role now that you're the founder, even though you are a physician? What's your role when you guys actually go there?
Yeah, so one of the
things, or even preparing.
Right. So what we do here in the United States, including Dr. Roxon and our project managers, what we do is sort of, first of all, we try to figure out exactly where we're going next. And then once we know the community, my role is to ensure that this is, in a way, we pick. So we want to be in communities where healthcare is needed, but we also want to make sure that there are other communities around that will benefit it. So this year, for instance, we're going to Quo, Etibie. Etibie is surrounded by 17 other villages. That's what we need. We certainly, we have a team of about 60 people who go to these communities. So we want to make sure that they're going to be busy and have more than they can handle. So, the same thing when we went to Esiako. Esiako was surrounded by numerous villages. We had people who came all the way from Nkwetia and Kumasi and even Accra when they heard of us going to Esiako. So that's what we want. We also one of the things I do also as the founder is to make sure that we have the necessary resources, medication, supplies, we arrange for transportation. And then we also want to make sure, of course, safety is important. We also want to make sure that we can recruit the team that we need. So, we keep expanding. We now have a urologist on board. This year, we hope to do some general surgery, which will be the first time we've done general surgery. We're already working on getting an ENT doctor to come with us next year. We are talking to some dermatologists and allergy providers to come with us next. So we keep expanding. And my goal as the founder is to keep going out there and look for more people to recruit. It's an international organization somehow. We don't just, have a team from the US. We, as I said, have people from Ghana. We have two volunteers who come from the Emirates who fly down every year to join us. So we continue to do what we can to make this an international organization. And so I have multiple roles, but I am very fortunate to have such a wonderful and supportive staff. My vice president is fantastic. He works with his wife Bella, who is our secretary, also with the dental team. My wife is a nurse. She always has her hands full. I have good friends like Dr. Anson and the Ghana team, which of Dr. Opata and several other people who each one of them plays a significant role. We have a fantastic project management team, Sam Brobe and Richard Ouzu. People play significant roles that are just amazing, and we all do, and we're able to do this because somehow we each try to find a significant role to play. So I have to tell you, my role usually it's just putting these teams together and sort of getting each one to do what they can to make it a success.
Yes. And your personal, how do you feel about your personal accomplishment? Do you feel like you have reached your goal, or is there still more things you'd like to see happening? I know you talked about it being somewhat international and getting people who volunteer from all over. What else are you looking forward to do in terms of the goal for the organization?
Yeah, well, I want us to continue to be able to provide the care people need in Ghana. As I'm sure you're aware of, there are people in rural areas and in communities that get no care, that have no access to any health care. And at GMR, we really think that it's very important to invest in preventive health care. Of course, when we go to these communities, if people have specific medical problems, we are happy to address them. But the goal of the organization is really to help with screening and preventive health care. We believe that if you can invest heavily into preventive health care, you will have less sicker people who will need tertiary care. Okay, so, and this is the problem that we have in places like Ghana. So if you live in the northern region and for instance, you need, heart surgery, you have to find your way to, Kolebu or to what do you call it, UST Komfanochi in Kumasi. Where are you going to live? What would you do with your family at that time? So, now if you can invest in preventive health care and some of the other screening modalities that we know work, you have fewer people needing long-term care, you have fewer people needing, major surgeries. And so we sort of try and fill in that void that is often missing.
Absolutely. And with the whole pandemic going on, how did GMR respond to COVID-19? What are some of the things that your organization did to assist the pandemic, whether it was here or in Ghana?
Yeah. So we had a very difficult time during the pandemic because our entire mission is sort of provide care in Ghana. So what we did was obviously during that time there were all sort of strict traveling bans, and we just couldn't make it. I think in May we made a decision that we weren't going to be able to do this year. And so what we did was at that time we had some medical supplies, some PPEs that we decided to sort of give out and make sure that people could use it in our absence. We actually had some PPEs here in the US, and we were going to ship those PPEs. So I sort of returned those PPEs back to the hospital so they could use it here. And then we made a commitment that we were going to do what we do best, which is continue to put together the supplies and equipment so that this year we will have a bigger mission. We are very proud that during that time we were able to actually acquire 2 ventilators, which is a huge deal. And so this year at GMR, we actually have 2 ventilators to work with, which is, as you know, ventilators are pretty hard to come by. And so, we usually ship, our shipment usually is about half a 20-foot container. We put together so much stuff that this year we were able to ship a 40-foot container, and we are looking forward to all these medical supplies, giving most of them away, trying to use as much of them as possible. But most of these will be given to community hospitals in Ghana, and we are very excited about that.
That is very exciting. We're going to take a short break. Let me just give a shout out to our sponsors, Ghana National Council, Omama TV, and Holiday Africa. We are speaking with Dr. Owusu, who is the founder of Ghana Medical Relief. Please stay tuned, share the feed, and we'll be right back.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
Check out this beautifully made artistry of coffee tables made from a combination of recycled tires, jute ropes, wood, and fabric to suit your style. Yes, we make to order. These coffee tables can help you make a statement in your bedrooms, offices, and living rooms. But remember, we only ship within the USA and Canada after shipping cost is paid. Call Jasper Designs on 1-306-203-2650 or email us at doduyayra@gmail.com. Follow us on Instagram at Jasper Love or follow Pearl Yara Agboka on Facebook. Don't be left out. Please place your orders now.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait, hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back. We are speaking with Dr. Owusu. He is the founder of Ghana Medical Relief. At this time, I want us to show a short video from Ghana Medical Relief so all of us can see exactly what they are doing in Ghana. Let's take a look at this. I think we're having a little bit of problems with the sound. I'm going to let my technician, the manager, work on that, and we'll continue our conversation with Dr. Owusu. Oh, here it is.
I think like any other society, women's health is essential and they deserve special attention. And women they do get some care, especially during pregnancy. There was programs in the Ministry of Health that ensure that they get good health care. And pregnancy care, people get significant attention. However, where things fall apart are some of the other areas where, for instance, routine screening is not something that's commonly done, and then we have women who have usually have other GYN concerns and things like that and problems. So what we're doing here is sort of going through some of the screening processes for the MNC women with specific GYN pathology and GYN problems. If ever might find a place in their heart, Jesus is.
So, what are your overall thoughts on the dental health of the people that you've seen so far?
I don't want to say terrible, but it is. Most of them do have periodontal disease, and the problem is they don't go to the dentist. They rather choose to go to herbalists, and that's really causing a lot of damage to their oral health.
So, what's the most interesting case you've seen so far?
Most interesting case was just this morning. A patient who's had gum disease with a facial swelling, sinus tract. I guess we can't go too much into technical terms, but has like a sore in the jaw. The bones that supporting the teeth are pretty much all dead. So we had to take out about 4 teeth in one area of the mouth, cut the gums, and pull out all the, clean out the dead bones. We couldn't do everything because, of course, this is not a hospital. Interesting. Hopefully to see them again to follow up before we leave.
I think the overall urological health, we've seen a few unfortunate cases, but the majority of patients, I think, are relatively healthy urologically.
Thank you very much. We're going to be showing another video a little bit later on in the program. But as you can see, that's one of my favorite videos. As everyone who knows me knows that my hometown is Anamabu. So very excited and so grateful for GMR for providing that very valuable service to all my family members that do live there. So Very exciting. Very, very exciting. So, Dr. Owusu, tell me, do you think that healthcare in Ghana is accessible and affordable? I love asking people this question. Do you think healthcare is accessible and affordable? Why or why not?
Yeah, well, so this is probably a problem not just in Ghana, but in any third world country or in any poor country. I mean, even in the United States, healthcare is not affordable, accessible to everyone. So, let's not be surprised if that's the case in Ghana. And there are several reasons. We talked about how. So I come from a village in the eastern region called Unisi, and Unisi is surrounded by several other communities. And the nearest healthcare center we go to is a hospital in New Tafo. So if you talk about the hospital in New Tafo having to serve the people of Unisi, Marcy, and other communities, and New Tafo had only one doctor and a few advanced practitioners. So it becomes very, very difficult. And so when you go to these communities and when you go to these hospitals, screening is not even an option. People go there when they are really sick. And here we are talking about things like preventive healthcare. So it becomes very, very difficult. And it's unfortunate, but that's just what it is. That's just we don't have enough healthcare providers. We don't have enough institutions to provide the healthcare. So yes, it's not that easily accessible and it's not that affordable. But these are, and this is why we need organizations like GMR to fill in the void. So yes, it's unfortunate, but I will have to say that it's not as easily affordable as you and I will like.
Yes, very, very true. And so how does GMR plan to help the Ghana health system, or what are you guys doing? I know all the things that happen there. So this is a yearly program, right?
Right.
Within this yearly program, you're able to bring these amazing services, but then what happens after you leave? Is there some type of follow-up program? I know you have a team in Ghana. Are they following up with these people, or what do we do after that?
Yeah, very good. So, and this is why we work with the Ghanaian team. So this year, for instance, we have 10 physicians from Ghana as well, and then we have nurses from Ghana who are joining us. So when we go to a community, one, we have Ghanaian physicians and healthcare providers with us, and when we leave, what happens is sort of we sort of create a bridge, and if people there need any further care, they sort of have access to some of the providers when we leave. Also, when we get to a community, so again, this is why most of the stuff we do tends to be screening. So, for instance, if you're screening, then you probably shouldn't expect too much of a follow-up. But when we see people with serious medical problems, we certainly want them, give them an opportunity to follow up. So let me give you an example. So 3 years ago, we were at Isiakwa, and we saw a young boy who had been born with what we call bladder atrophy, which is pretty much the bladder was outside the abdomen. And this young man has had to live this horrible life. He had, you could tell from his face that he was a shy young man. He probably had been bullied in school for his condition. And the urologist who saw this young man made arrangements so that this young man could get the care he needed at Korle Bu, because he needed surgery. And so we arranged with Dr. Mensah, who was then the urologist at Korle Bu, and we sort of helped this young man get the care he needed there. Similar thing happened last year when we were in Anama, but we saw a young man who needed some work done, and we've sort of followed up with this young man. We make sure that this person can get the care they need elsewhere. And we always assign these patients to one of our providers back, who are part of the Ghanaian team. So yes, we do our best to have some kind of a follow-up. It's not always possible, but when we identify people with specific problems, if we cannot completely give them the care they need, we will do our best to make sure they have, follow-up arrangements. What we hope to do in the future, and we are working with the John Agyekum Kufuor Foundation. One of the videos you saw, you will probably show later, is President Kufuor was very impressed with our work, and we got a chance to meet him, and he wants the John Agyekum Kufuor Foundation to work with us. And one of the things in the future, we'll be signing something called Memorandum of Understanding between the two organizations, and we are getting the Ghana Embassy involved. What I would like to see in the future is when we see people who need specific surgery, advanced surgery, I want to be able to have the opportunity to sort of make arrangements for them to come here in the US, work with some NGOs here, and be able to perform these surgeries and send them back home. And so, we have I have great hopes and I have great dreams, and I think we can do that. I think that once we have these things established, then we have the right people in the right places and right channels, we can do some of these fantastic programs. Because one of the things I learned in Ghana, and you see this in Ghana too, you always hear on television we're raising funds for a young man who has some kind of cardiac condition to go to South Africa and get care and things like that. If we are in the right place, when we get to the right place, we can sort of make a difference in some of these programs, and so that's what we are hoping to do. We hope that in the future, not only will we have follow-up for some of these patients who need special care, but hopefully we'll be able to work with programs and organizations here in the US that will allow us to bring them here and give them and have them get the sort of specialized surgeries that they may need.
Wow, that's very good. And you spoke about it being more screening. So when you look at preventative medicine, once a year is actually pretty good to get screened for all those things, even though, I mean, here it'd probably be a little bit more often if you were hypertensive or had diabetes. So you mentioned that with the process, people go and get medications. So now these medications that day are free. What happens, like, so how many pills do they get? Let's say that you realize somebody was extremely hypertensive or had diabetes, and you sent them to the pharmacy and they've picked up maybe, I don't know, calcium channel blocker and maybe some metformin to start them off with. So then now, let's say, I don't know, 3 months go by. Who do they go back to get the medications? Will the medications still be free underneath the program, or they need to now purchase it maybe at a discounted rate? Yeah.
So one of the things, and that's a very good question. Obviously, because we are, an organization, this is where some of the funding becomes an issue.
Of course.
What we try to do when we diagnose people with hypertension and things like that, the first thing we try to do is give them medications that can be refilled easily in Ghana. So even our medications, we spend some amount of time making sure that we will start them on medications that they can easily get in Ghana. So we sort of we work with some of the pharmaceutical companies in Ghana. This year we're working with NS Chemist. Last year we had Dow Pharmaceuticals, and they were very helpful to us. So we will start them on prescription medications that they can simply get refilled in Ghana, and we want to make sure that these are very cheap medications. So for instance, when it comes to something like hypertension, we don't use some of the fancy hypertensives they have here. We use drugs like amlodipine, which is very cheap. It would be nice if we could give them a year's supply of every prescription they need, but obviously that's not possible. But we try to give them as much free samples as we can, and we try to make sure that we use medications that they can afford in terms of refills. What we also do at the end of every program is whatever medications are left, we donate it to that particular site so that people can come back for refills. So last year, for instance, when we were done, we had lots of medications that were left, and we left them at the hospital. And we will usually tell these patients, hey, if you run out of medication, maybe you can come back and see if you have any more free samples left. So we do that. So most of them are able to come back later on, maybe get a few other samples. But, I think one of the things that happens is, once somebody is diagnosed with, say, hypertension, and usually this is the story. You have somebody who comes to clinic and says, I've had this headache for many years. I'm not sure what's going on. And then they get screened and they find, oh my God, it's hypertension. Sure, we give them some free samples. And I think, things change. They sort of now look at things differently. Yes, right. It might be expensive for them to get refills, but they now understand that this is something about their health. And maybe the next time they get, a CD or a couple of CDs, they know that, we all want to invest in our health. So now that they know they have this medical problem, most of them will do their best when they can to sort of pick up refills and medications and things. And also, when we get to these places, sometimes we will see people who come to us with sort of old prescription and say, a group was here 2 years ago, they gave me this medicine, I've not been able to get any refills, and then we will sort of give them most medications as well. So it's a tough thing. I wish we had enough medications to give everyone for a year, but we do our best, and I think most people also do what they can to refill their prescriptions when they can afford it.
I agree, and I think it's a certain amount of education that goes with all these things too. With preventative medicine, of course, you want patients to understand that a lot of this thing can be changed with different lifestyles. So hopefully, with some lifestyle changes, even with the medication too, can also assist as well.
Very good point. One of the things we do at GMR is not just give people medication. We actually have seminars. We have seminar on hypertension, diabetes, high cholesterol, dental care, and we do these seminars as well. And that's a very good point. And what we do at these seminars is we teach them about their disease, what they can do to improve their prognosis, what lifestyle changes they have to make. And that that helps a lot. Our volunteers are very good at running these programs, and it is one of the, I think, the components of what we do that really changes the lives of these patients.
Wonderful. And we're looking at all these beautiful pictures, and we see there's a lot of people from different countries there. So tell me, what has been the experience for non-Ghanaians who have joined you to come back to Ghana to help out?
Well, I think when you visit our website, we have a section called the testimonial section. I think I have no doubt you've had remarkable experiences. So what we do is, so we don't just bring them to Ghana and put them to work for 5 days and send them back home. We have other things built into our program. What we do is, so we run the clinics for 5 days, and then we take them around the country. We've taken them to places like Akosombo. We always make sure we take them to the Cape Coast so they can see the slave castles. This year, we're planning to take them to Menchia Palace. In the past, they've had a chance to meet President Kufuor. And so they have a wonderful experience, So, to them, this is not just a medical mission, but it's also an opportunity for them to, come to Ghana and get a nice tour of the country. They also get a chance to interact with healthcare providers from Ghana, and they get to learn about the traditions of Ghana, and it becomes a win-win for everybody. I think the providers in Ghana, when they get a chance to work with the American team, obviously learn a few things. One of the things that I think is significant is they sort of learn how to interact with the patients. They learn about things, more about things like compassion and better patient interaction and better patient care. Our team also gets to learn from the Ghanaian providers a little bit more about infectious diseases and how to interact with Ghanaians. Obviously, this is a different culture for them. And so it's a win-win for everybody. What we also do is, before we even leave for Ghana, we have platforms on WhatsApp, and everybody gets to sort of get to know the other person on WhatsApp. It's a huge platform. And then when we get to Ghana, we obviously, when we stay in hotels or wherever we stay, we sort of mix people up. So if you're from Ghana, your roommate will be somebody from the US and vice versa. Obviously, if you are there with your wife, then the two of you will be together and be roommates. But we try to do that. When we set up our various stations too, we try to do the same thing. So, if you are, say, covering urology, you could be a Ghana nurse working with an American doctor and vice versa. So that creates an environment where people get very quickly to know one another, and the interaction is better, and it makes for a more cohesive and more pleasant experience for everyone.
That's really nice. I know people are very excited to be able to travel. Let's take a few questions from our platform. I see that a lot of people have been responding to us. So just reading a few of the comments. Abigail says, Dr. Samuel Owusu Empress Mawasi says that people should share. Thank you. She also goes on to say, this is Abigail, yay, ventilators. Emma says, go GMR, one village at a time. Ibrahim says, Dr. Owusu, please, have you thought of establishing a hospital in Ghana that will be working 24/7 or probably supplying equipments and meds to designated hospitals subsequently as you leave Ghana? Because, doctor, we can't wait for you to be coming to our aid yearly. Daily or monthly, I think will really help. What do you think about that?
Well, I listen, I would love to be able to do this full time. This is why I went into healthcare. I'm very passionate about this. I really enjoy providing healthcare to women's health to be in particular, but I enjoy healthcare services, and unfortunately, one of the ways we're able to do what we do is because we work here and we have that access to be able to get all these equipments and bring them back home and share them with the institutions in Ghana. We are sort of like a hospital on wheels. Here in central Pennsylvania, there are several hospitals that know about GMR, and they donate equipments to us all the time. And, we get these equipments, we bring them to Ghana, we use them, and then we give them to other institutions there. So it's a wonderful collaboration. We sort of are able to do that because we are here. So our presence here is also important because that's what maintains the relationship. But hopefully in the future, we'll be able to do more than one mission a year. I mean, that's what we hope to do. I hope that in the future, we'll be able to do more than one mission a year. And I think that would be great.
That'd be nice. So please allow Dr. Owusu to stay so he can get more stuff for Ghana. Denise says, awesome. And then Mr. Ibrahim goes on to say that I guess this 40-feeder container will be duty-free. Doctor, please try and fight for duty free, okay? Because my people will definitely try to take money, even if they confirm it's a donation that you're going to do. Well, we thank you for that advice. Empress Mausi says healthcare in Ghana is not too good. Mr. Ibrahim goes on to say that Dr. Cromwell, some regional hospitals in Ghana have either one incubator or one or none at all. You always meet mothers and newborn babies lying on the mattress in the corridors of the labor wards just a few hours after labor. I mean, regional hospitals also. You can imagine what happens at the rural areas. It is so disheartening, Dr. Owusu. And yes, unfortunately, we are well aware, and this is why we are bringing light to some of these things so we can be able to assist more. So thank you. Mr. Johnny Wood says, does Ghana National Health Insurance Card really work? If it does, what does it cover? And that's a question I get from a lot of people. So is it the NHS? Like, what exactly does it cover? They gave me a list in Ghana, but I don't know. What exactly does it cover?
Yeah, well, we probably can ask our Ghana colleagues about it. But, what we do is free. So whether you have a card or not, it becomes irrelevant to us. What we're actually going to do this year, but my understanding is that it covers some basic stuff. And actually this year, we're also doing some, I'm glad you brought this up. What this year we plan to do is, we hope to pay for as many people as we can to get the card. And this is a program by Sam Brobe, who's one of our project managers. He's very passionate about this. So we're working with Ghana Health Services to sort of give us a discount so we can pay for maybe a couple of hundred people to get the card. My understanding is that it covers some basic stuff. So, at least it's better than nothing. So I think that is something that, and I think people, there are still people who cannot afford to have this card, and I think it's a yearly payment or something. But Sam Brobe is very passionate about this, and I think it's a great thing to do. So we hope to this year, as part of our contribution, also pay for a couple of hundred people to get the card, so that at least some of the basic things they need can be taken care of when we leave.
Yes. And I think when I was in Ghana, for sure, there were a number of diseases that are covered on there. And I believe hypertension and diabetes for sure are covered on there. It's just some of those other ones. I know like dialysis, unfortunately, it's extremely expensive even here. So that's something that, can be covered there. But for the most part, a lot of preventative diseases, the medications and some things in the visit, I know are covered under that. But that's a good question, Mr. Woods. We will find someone to come and actually tell us about that. That'd be good.
Right. And that goes to answer your previous question. So if we can diagnose people with hypertension and diabetes, start them on some medications, and then give them the card, hopefully they can get refills of their medication. So some of these things after a while start to sort of complement each other. So I think that's a great idea. And we will certainly make sure that happens.
Yes. And then we have, let's see, Amy is watching us. Mr. Isaac is watching us. Nancy says, go, Dr. Sam. God bless you. Michael says, greetings to you, Dr. Owusu and Dr. Cromwell. Go, GMR. And then we have Mrs. Nunu, who is my mother, watching, and a whole bunch of other people watching. Oh, we appreciate you all. Continue to share the feed. Send in your questions. We also have a WhatsApp line. The number will be placed across the screen if you wanted to call in and give your contributions. But we're just going to continue our conversation. So we know that the mission is coming up. So the mission is coming up in August, right?
That's correct.
So tell us about when the mission is. You told us a little bit about where you're going, but what is your plan? What is your goal to accomplish this time? You mentioned that before you guys saw about 4,000 people. Here we are post-pandemic. You couldn't go last year. You're geared up. You have more supplies. So what are we looking forward to? And I say we because I'm going to be joining them.
Okay, I'll hold you to it.
What are we looking forward to in August?
Right. So this year, as I stated earlier, we're going to Kwo up in the mountains. We'll be operating from ATBA Hospital. We hope to have the same services available, including obstetrics, gynecology, urology. We're looking to do some general surgery because we are in a hospital setting. Pediatrics is extremely important to us. We always have about 4 or 5 people doing pediatrics. We hope to run our seminars as usual. The seminars are so important because, we sort of have to educate people on their disease processes. We sort of have to teach people how to take better care of themselves. It's not just enough to just throw pills at people. So we hope to continue to enforce that section of our program. We also have a wonderful CPR program. It's fascinating, and we'll talk. Hopefully, get a chance to talk more about CPR. I mean, this is basic life support that always continues to be ignored in our country, and that's a terrible thing to do. But we will talk more about that later. Now, what we hope to do. Obviously, I don't think we'll be able to take screen 5,000 people as we would like to, but what we would do, because of the pandemic, is one of the things that GMR is requiring this year is that all the volunteers be vaccinated. Okay, that's a requirement for all our volunteers, and we will continue to mask. And I heard you talking about masks earlier with the pharmacist who was on earlier, and then we will also provide masks for everyone who comes to see us. So we'll have PPEs for the staff and for the patients, and then we'll continue to take care of them the same way we do here in the United States. I mean, when you see people in your office, whether they're vaccinated or not, the protocol is the same, right? We will try and do as much social distancing as possible. In the past, what we usually used to happen was, we will have a tent and we will have people underneath the tent, and the goal was to go through as many people as possible. This time we'll do things differently. We will do our best to implement some of the CDC requirements. We'll do some social distancing, and we will sort of encourage people, and we'll probably end up seeing less people. But we will continue to do our best to give the best possible care we can for the people, and that's our goal.
Absolutely. And as you can see on our screen, we actually have the Cash App where you can be able to donate funds to GMR. Remember, this is a free program that they provide to people in Ghana. So it's going to take all of us who are here to be able to donate, whether it's $50, $100. When we come back from our break, I'm going to actually have Dr. Owusu break down some of the things that can be purchased with some of the money that you're going to buy. So you'll be able to get a better idea as to what can be purchased. But his Cash App is there on the screen. Please find it in your heart to donate something so we can be able to continue to help the people in our dear motherland, Ghana. We're going to take a short break. We'll be right back. Continue to share the feed. Thank you.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too fake news. Then don't share. Why not go to the right place for Corona news? Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UKAID.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Noun GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Noun GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Noun GH, your doctor, is now at your fingertips.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for staying with us for this wonderful program dedicated today to the Ghana Medical Relief. If we go back to our feed, we'll just continue on. Looks like Miss, let's see, Emma Awusu says, please donate to GMR. We are doing great things in Ghana, but we do need your help. Thank you. We'll definitely do that. Patricia says, can the Ghanaian government waive the COVID test for this volunteers? Good question. Empress Mawasi wants to know how we can sign up. And yes, we're going to go through that in detail so people will be able to sign up. Evelyn says that Evelyn is watching you. We will have some good news for you. Belinda says, good job, Dad, from Kevin. And we have a slew of people watching. I'm so grateful. Continue to share the feed. Definitely post your comments, your questions. We are so grateful for everyone that's watching. What I'd like to do right now is we want to talk about funding, right? So we've talked about this program at length and how wonderful it is and how people, donate and people from all over come. But we know that all these things are going to cost money. So there's a few things that we want to go over. I know that your project manager sent me just a few items for us to highlight so people could just kind of get an idea if you donate this kind of money, what you can get. So let's start by let's talk about the pediatric malaria medication. It looks like for $50, that's what you can get. So tell us a little bit about that, Dr. Wu. So what would they get for that? Or
Right.
what will people get if you donate $50?
So what we're trying to do is GMR is not funded by a church, an institution, or any government entity. We are basically a group of people who raise funds, and we're able to do this because of support from friends and family like those who are watching. And we sort of raise our own, we raise funds, and then we use the funding to cover the cost and to cover everything we do when we're in Ghana. I have unbelievable stories. So there are several nurses from my hospital who come with me. There are nurses who go to a blood bank and donate blood 2-3 times just so they can buy a ticket to come with us. I mean, how moving is that? And these are not Ghanaians. They are so committed to coming. They see our pictures, they see the work we're doing in Ghana, and they put themselves through this. They sort of, there are nurses who do bake sales. There are people who have spaghetti dinners, all to raise funds so they can buy their ticket and come to Ghana with us. And it's very moving. These are people who are so committed and who are so interested in what we do. And so those of us from Ghana can do more. We obviously have to support these programs. And, because when you see, our friends from the US doing what they can to support us, how could we not do that? So, we rely completely on donations and funding from friends and family. We are not supported by any church or any organization. We're trying to figure out how do we sort of give people an idea of what their donations can do. And this year we had a remarkable donation. We had a young lady, a 23-year-old who sort of, she's never been to GMR, but her mother went to GMR with us, and Nanani Mako, that was Patricia, who represented. Her mother went to Ghana with us, and she was so impressed with the work her mother did that this year, this young lady decided to donate $2,000 of her own money to us, and wants us to sort of use it to buy supply. And how moving is that? That's fantastic. You very seldom hear stories like that. And this is a young lady who just saw the work we did in Ghana. She watched our videos. She saw some of the work we did online, and she heard the stories, from her mom. It was just amazing, So for us, as we've said over and over on this program, everything is free. But let me just give you an idea of what some of these donations can do for us. For $50, I think we sort of for $50 we can provide malaria screening and treatment for about 5 people. Okay, and that's fantastic. To think that the donation of $50, and malaria is very prevalent, as most of you know, in Ghana. It is probably the most common parasitic infection in Ghana. It is the most common cause of hospital admissions for young people in Ghana. We often forget that people actually die from malaria, and sort of you can save a life and save a few kids' life by donating $50 so that we can screen children and we can also give them the treatment cost they need for $50. For say $100, you can also provide complete dental care for 5 people. Dentistry, if you think dentistry is tough in this country, try Ghana. dentistry is so bad because most people don't get a chance to get preventive dental care. And we are fortunate to have Dr. Raxon and his team to help us with that. Dr. Raxon and Bella, his wife, and Dr. Uso and some from Ghana, and a couple of dental assistants who are committed to this. Periodontal disease and periodontal disease is so severe in Ghana. We're talking about, there are cases we see in Ghana that are what we call stage 4 periodontal disease, where periodontal disease is just a fancy term for, gum disease. But we've seen patients who have had their gums completely eroded through their jawbone, through the skin. This is extensive stuff. This is what we call stage 4 periodontal disease. And these are very labor-intensive procedures. They require several debridement, and they require several medications and supplies to do that. But we are, Dr. Raxon and his team are happy to take care of these patients, and we're able to do that, again, because of donations from friends and family like you. When we see these patients in dentistry, I have to give them credit. It is probably one of the most difficult departments in our program. They are the first to get in the morning and they're the last to leave. We always say they hold up dinner. They're the last to leave every day. But so when they see these patients, most of the patients end up getting some kind of extraction. I remember one time in the Siakwa, we saw one lady who on the spot needed 6 extractions at one sitting. That lady was so sick. She couldn't eat. She was pretty much withering away. It's a life-changing experience for these patients. And when they see these patients, not only do they perform the procedures they need for them, but they also end up giving them nice dental packages, including toothbrush, toothpaste, dental floss, and then we sort of try to get them to sit through our dental care program where we teach them the importance of dental health, and as an obstetrician, I can tell you, one of the most important things, for pregnant women is good dental care, because, it's very easy for them to get septic, and we don't even think of things like that. If you have an abscess or tooth decay, you can really get sick and you can end up getting septic from that. So we sort of, try to encourage a lot of these patients to go through the dental program, and we do our best to sort of make sure they get the care we need. But I always have to applaud the dental team for the work they do. Dr. Raxon is this is a gentleman who has his own private practice in East Orange, and he works with his wife. And they literally shut down their practice 2 weeks a year so they can come to Ghana and do this for our people. What a wonderful and remarkable way to give back. And so we're appreciative of that. So for $100, you can provide that kind of care to a family of 5. When we were in Anamabo, we had an interesting experience. And for $200, we think you will be providing a wheelchair for a handicapped individual. We had an interesting event when we were in Anamabo, and I think we saw one of the pictures. So we met a lady so we were in clinic one day, and we were told that there's a young lady waiting sitting under a tree about 50 meters from the clinic. And I wasn't sure who wanted to see us, and I wasn't sure why this young lady wouldn't come in. So that's the picture there. So we walked, I went with a nurse and a volunteer, and we walked down to this tree, and this lady was just sitting there trying to catch her breath. It turns out Esther was a young lady who, 6 years ago was in a car accident, and as a result of the car accident, she lost both her legs. So she's a double amputee, if you look at that picture. Now, her life obviously hasn't been the same. She relies on people to move her from place to place, and she continued to have some other medical problems and heard about us and wanted to come and see us. So she got friends to bring her, but they could only get her as far as to that tree. Anamabo Clinic, I don't know, the entrance is a series of steep steps. So she asked someone if they could come and talk to us, and we were glad to go see her there. Give her, you can see me. We gave her, took care of her, provided the care she needed, and then after that, we decided, why don't we just give her one of our wheelchairs? We had wheelchairs just to move people around within the clinic. So we gave her the wheelchair, and boy, did her life change. She is so happy. She can now move around from place to place and do what she needs to do without relying on friends and family. And that's a life-changing experience, right? A positive one indeed. And so at the end of the program, I said to myself, so we have these 4 wheelchairs that we use just for our clinics. We're here once a year, and why don't we just give the rest away? So we went around and looked for other people similar to her, in similar situations who needed wheelchairs, and we just give them away. So our goal every year is, when we take to get some more wheelchairs, use them in clinic, and at the end of at the end of the program, donate it to people who need it more than us. And these are some of the things that we are doing at GMR. So for $200, you could be, making a difference in the lives of the Esthers around the world, or in Ghana to be particular. So I think it's a wonderful way to make a difference in somebody's life. Okay. The next thing I want to talk to you is what it's about CPR. So there was a picture about CPR. We went to one of the things we realized was that in Ghana, CPR was something that was completely ignored. Now about 1.5 million people a year end up with heart attacks. Okay, and about 80% of these heart attacks usually occur outside the hospital setting. They usually occur in the residential setting. So about 350,000 people, each year die before they can get to a hospital when they have cardiac arrest. All right. Well, whether you survive or not when doing a cardiac arrest depends on how quickly CPR can be started. So this is one of the most important things that we have to teach our friends, our family, churches, homes, schools. We have to, we all need to know how to do CPR so that we can stabilize people before they get to whatever tertiary care center they need to get to. And in a place like Ghana, where we don't have EMS, where you can't just get on the phone and call EMS, it is even more important. We actually, as Ghanaians, I don't know if most of you remember this, but we've had 2 ex-vice presidents who died because they were found unresponsive, and nobody thought about doing CPR on these presidents. And instead, people spend time trying to get a taxi to get them to the hospital. Well, if you can do CPR, you can make a difference in your lives, and you can improve their prognosis. We're talking about, accidental injuries, things like choking, drowning, motor vehicle accidents. These are the leading cause of death in young people. Okay. In Ghana, majority of people are young people. Now, about 16 million people each year end up in the ER because of things like accidents and other things that can be handled. They end up in the ER. 60 million cases end up in the ER because of this. All right. So, being properly trained in CPR, can be the difference between life and death for your loved ones. And that's important. That's important. So, we at GMR, we have one mannequin set, and that's it on this display. And we take it around this. We went to Agri Memorial Training School. We wanted to teach the teachers CPR. We were able to work with the nurses on CPR. Most of the nurses we found out haven't had any CPR retraining in 10 to 15 years. All right. So we talk about, here you are, you're talking about having hospitals and all these things. And, most of them haven't been retrained. And CPR has changed over the years. Here in the United States, you have to be recertified every 2 years. In my hospital, for instance, we require housekeepers to be CPR certified because it is possible that the housekeeper is the one who might run into an unresponsive patient in the stairway, not the doctor. So it's essential that we all get trained in CPR and not just wait for the patient to get to the doctor or the nurse to start CPR. So so that's something we're very, very passionate about. And so we want to bring CPR to schools. We want to bring it to churches. We want to bring it to homes. We want to bring it to work. And this year, that's what we plan to do at CORE. We're going to make sure that the hospital employees sort of get a refresher course on CPR. We want to spend some time out in primary school, at the churches, so that when you're at church and someone becomes unresponsive, we want the pastor to start CPR while the rest of the congregation screams for Jesus. Okay, these are the changes that we are hoping to make in Ghana. And for $500, we can buy an additional CPR mannequin sets. So that's what we hope to do. And so that's what your donations can do for us.
Wow. Wonderful. As everyone has seen, they have great plans to be used for the money. So please make sure that you donate something. If you even can't donate today, you can always contact Trend Africa TV, and we'll make sure that they get their donations so they can be able to make a difference. CPR is extremely important. Would you be able to give people like completion cards, or what is the plan for the future? Because I believe that some of these places, once you teach them, they may need a refresher course. And I know you always choose different villages. So would the people there, would you train some people there to be instructors so they can continue on with the training of the CPR?
Yes. So what we do is when they complete the CPR, they get a certificate from GMR. similar to what you get when you do a CPR from the American Academy of Cardiology. So, so we give them certificates at the end of the CPR program. And so, again, if we have enough mannequins, I would love to donate the mannequins to the hospitals and the institutions when I leave. But as it sits right now, I only have one mannequin, so I have to kind of hold on to it, But the goal is to get enough mannequins so that we can sort of donate some of them to these hospitals. I mean, to think that a hospital like Quill Hospital has 0 mannequins, that's sort of sad, I mean, most institutions have numerous amount of mannequins, and so we want to be able to have mannequins, and then we even want, the next thing is for us to even teach NRP, which neonatal resuscitation, which is also very, very important. But I think that for now we are focused on CPR, and we sort of and I have no doubt in the future we will move on, like in most GMR events we will add something else to it. But right now, yes, we certainly want to be able we hope to get more CPR mannequins so we can continue to reinforce the significance of that process.
Absolutely. And as you can see there, payment for the program is on the screen. So we are encouraging all of our viewers today to not only share the program, but also share with others who will be able to donate to this notable cause. We're going to take some more questions or read some more things from our feed. There's also a short 2-minute video that was sent to us that we want to show. And then we're going to talk a little bit about COVID-19 in Ghana. Dr. Wusu did go to Ghana not too long ago to go ahead and scout out everything and make sure, as he indicated in the beginning, that his job is to make sure that things are safe. So we want to just ask him about some of the things that he saw in Ghana pertaining to COVID-19. Let us take a quick break while my producer gets that video to show, and we'll be right back. Don't go anywhere. Thank you.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call Mobile Doctor. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
Father, help your children and don't let them fall by the side of the road. And teach them to love one another, that heaven might find a place in their
above and beyond. They care so much about the people that come with them and also the patients that they're taking care of. So it's a wonderful experience. And I was so lucky to be able to come back here again and come to Ghana again. I love this country. The people are amazing, and I'm really happy to be back.
I know the truth, and His word will be our salvation. Lift up our hearts to be thankful and glad that Jesus is Lord. He won't let you down. I know He's deep down in my soul. Jesus, He's He won't let you down. And I know He's mine forever. In my heart. Help me. Heart. Heart. I know. He loves the power. He loves the glory. I wanna follow you, star, wherever it leads. I don't mind, Lord. Hope you don't mind. I wanna walk with you, talk with you, do all the things you want me to do. 'Cause I know that Jesus is love. I know. I think that I think the first day we saw about 450, the second day we saw about 850, and I believe today we've seen about 100 patients. I'm told that it's only 2 p.m., so we still have about 5 more hours to go. So I won't be surprised if we see maybe a couple of more hundreds before the day is over.
What are your overall thoughts on the OBGYN health of these people?
Well, I think like any other society, women's health is essential and they deserve special attention. And women here do get some care, especially during pregnancy. There are various programs through the Ministry of Health that ensure that they get good reproductive health care. And pregnancy care, people get some significant attention. However, where things fall apart are some of the other areas where, for instance, routine screening is not something that's commonly done, and then we have women who have usually have other GYN concerns and things like that and problems. So what we're doing here is sort of going through some of the screening processes for them and see women with specific GYN pathology and GYN problems. That heaven might find a place in their heart. 'Cause Jesus is.
So, what are your overall thoughts on the dental health of of the people that you've seen so far?
I don't want to say terrible, but it is. Most of them do have periodontal disease, and the problem is they don't go to the dentist. They rather choose to go to herbalists, and that's really causing a lot of damage to their oral health here.
So what's the most interesting case you've seen so far?
Most interesting case was just this morning, a patient who's had gum disease with a facial swelling, sinus tract. I can't really go too much into technical terms, but has like a sore in the jaw. The bones that supporting the teeth are pretty much all dead, so we had to take out about 4 teeth in one area of the mouth, cut the gums, and pull out all the, clean out the dead bones. We couldn't do everything because, of course, this is not a hospital, and we dressed him. Hopefully to see him again to follow up before we leave. I think the overall urological health is unaffected. I've seen a few unfortunate cases, but the majority of patients, I think, are relatively healthy urologically.
Thank you very, very much for that wonderful video. They are also available on GoFundMe as well. So you can always go to GoFundMe and put in the Ghana Medical Relief. You'll be able to see ways to donate there. Let's go back to our feed and see if there's any more comments or questions that we need to be looking at. And looks like we just have a whole lot more people who are watching, but we don't have any more comments. But once again, you can send your questions, concerns, comments. It will be read online. And even afterwards, when we're done with the program, I'll make sure that we get those questions answered. If anything in particular you'd like to ask Dr. Wusu, you can send it and I'll make sure that he gets that question as well. We're just going to go ahead and talk a little bit about COVID-19 in Ghana. So in general, I mean, the pandemic has been something that has affected all of us. This program, when we initially started, we called it COVID-19, the way forward, because as healthcare professionals, we were all looking at how we're going to be living after COVID-19. So for someone who was in Ghana, you went to go scout out the place. Do you think that people think in Ghana that COVID-19 exists?
Oh, absolutely, absolutely, and I think we saw that everywhere in Ghana. Most people, most people in Ghana had some kind of at least they had friends who had encounters with the disease, and it's obviously a scary thing. I think that people were very aware of it. Whether they were willing to comply with some of the recommendations is a different story. I mean, I still saw large funerals and large gatherings, and so that's always the case. But I have no doubt that anyone who people who live in Ghana were just as aware of this pandemic as those, just like those of us here. And I think that, programs like your show did a fantastic job educating people. I was very impressed with some of the efforts that were in place and some of the attempts by various, communities to sort of improve the lives of people. It was interesting to me. Every time I tried to get into a public building, it was a very pleasant surprise. They all had water hand washing stations, and they had come up with very interesting and very impressive concoctions. And my favorite one was there was one where you had to sort of there was a foot pedal and you were able to get a soap and water dispensed at the same time. No, that was fantastic. So people got very, very creative, and it was nice to see this. And I saw this almost, I think, every time I tried to enter an office or a public building. So I was impressed with that. I thought that was a wonderful effort. So I think that people were aware of it. People were very, very much aware of it.
And so overall, the response to Ghana when it came to COVID-19, were you pleased with the overall experience? Like when you were there, did you see a lot of educational programs on TV teaching people? Here, when you turn on the news every morning, they're always giving us statistics and telling us things. How would you rate all that in terms of the education piece in Ghana?
Yeah, I think the Ministry of Health did a fantastic job. And I think that some of it is a throwback from the Ebola experience.
Okay.
So during the, right after Ebola, Ghana had a lot of these, thermometer scans at the airport, and that was effective. So for years, I think every time you visited Ghana at the airport, you had to go through that scan, those scanners, and I think that was a very good experience. It was always helpful too. And the idea that even up to now, not for you to get to Ghana, you have to go through this testing process. Obviously it's a bit of an inconvenience, and you have to pay them. But it's important. I think that put a check on how many people were entering the country infected. So that made a big difference. And so I think I think the Ministry of Health did a great job. They've very early. I think the government also did a great job, because very early they sort of had all these restrictions, and there were these lockdowns which people did comply with. So that was helpful. I've seen programs like your show. You've done a fantastic job also educating people. At the commercial break, there was this wonderful commercial about share facts, not lies. Save a life, make a difference, be part of. Play a part. And these are wonderful things that sort of you see every day on television, but it sort of sinks in, and it brings awareness. So I was very impressed. I think that a lot of us, including show programs like yours, did a wonderful job educating people. And nowadays, because of social media, you can obviously, I see comments coming from Ghana. So there are people in Ghana who are watching your show, and they're getting the information they need, they're getting the facts, and that has been very helpful. And in Ghana too, the morning programs were very helpful. They obviously didn't report statistics the way we see on CNN every day, but they were very factual, and they were very encouraging, and they were very supportive, and they kept the message on board. So I think they did a great job. I think I have to give them an A. I think they did fantastic.
That's wonderful. Very, very good. So now that we've learned all about GMR, I know everyone's question is, how do you register? So how does one go about? And I saw something on your website that I thought was quite impressive. It's not only nurses and medical professionals that can also come. You have things for everyone to do, from photography and other things. So anybody can volunteer. Would you speak on that a little bit?
Absolutely. We want as many diverse people as possible. So just like in the hospital, not everybody in the hospital is a doctor or a nurse. We have housekeepers and other people who play, the ancillary staff who play a very significant role. So when we at GMR, so we and in the past we had a lawyer once join us. We've had several of our volunteers are not in healthcare, but these are people who are just interested in making a difference in people's lives. So yes, we welcome people from all walks of life. We welcome people with all different, with whatever agenda, but the agenda is the same. We want to be part of a program that will provide health care and improve the lives of the average Ghanaian. So that's what it is. So yes, if you go to our website, there's a simple form you just fill, and basically what we need is just your email or your phone number, and we will contact you and sort of give you updates on our next program and how you can be a part of it. So we want people actually, so our project managers, Richard and Sam Broby are not healthcare providers. They are both MBAs who are sort of helping us with some of the logistics. They do a fabulous job, kind of putting the program together. When we started this program, one of the things that was difficult was, if I have to run a GYN clinic, I don't want to be out there sort of managing some of the logistics or the traffic. So Richard, for instance, or Sam will be out there doing that so I can see patients. So everybody has a role in GMR, and everybody who joins GMR has an opportunity to be part of the program. But no, we certainly don't want just nurses and doctors. Sure, we need as many healthcare providers as we can, but there is a role for everyone. Over the years, we've had Janet, who is the owner of Aburi Gardens in Virginia. It's a wonderful restaurant, and she actually comes with us every year so she can do our cooking for us. So, we are very proud of GMR. We are very lucky. We sort of have our traveling chef with us. I mean, how many organizations can say that? And so, there's room for everyone. There's an opportunity for everyone to be part of our program. And all you have to go is go to our website, fill out a form. You have your phone number and your email. We'll get in contact with you, and we will let you know when our next session is and how you can be a part of it. And it's free to join. There's no fee or anything to join. We just want you to come with us and help us make a difference in the lives of the average Ghanaian.
Exciting, with a personal chef.
That's right.
We are really selling it here. Good, authentic food.
That's right. Yeah.
That's really exciting.
Yeah, it is. It's fun.
So people go on the website, and you mentioned that some people did fundraising and everything. So obviously you'd have to get your ticket, but I would imagine that there's a comprehensive package, correct, that would take care of people's room and board and everything. Tell us a
Right.
little bit about that.
Right. So what we do, Ajema, so when you join us, we all try to raise funds, and every year we set a goal of how much fundraising one should be able to do. And we have sample letters that you can send to your friends and family. You know, I'm a doctor in the hospital, and sort of, you know, I try to kind of, you know, hit up all my colleagues for it. I've gotten to the point in the hospital where when my colleagues see me coming towards them, they sort of find a way to go the other. So, you know, try to disappear on me, but that's what it does. It's a good cause, and once, you know, like anything else in life, when I think that, you know, it's always very difficult to ask for money from people, but I think when people understand that what you're doing people understand what you're doing with the money, it's a different story. People really appreciate the work we are doing, and they are proud and glad to support us. And if there's one time when you shouldn't be embarrassed to ask for money, this is it, you know. So we do that. We go around and we seek funds, and like I said, people do, you know, have spaghetti dinners, people have bake sales, people do whatever they can to raise funds, and, you know, it's helpful. So we sort of, you know, that's what we do. Now, as far as the package is concerned, what happens is, you know, because again, we're not funded by any organization, we sort of have to raise funds to cover our own expenses when we go to Ghana. You know, so we have to pay for room and board, and we use some of that money also to do our shipment. We use the same money also to pay for food and accommodation, and cover our tours. So, you know, once that's done, we always say to people, once you're done fulfilling some of these requirements, the only thing you need is your souvenir money, you know, and that's all. We work with a travel agent in Virginia who does a fantastic job getting us discount tickets, and so that becomes helpful to us too. And so, yeah, but yes, fundraising it's probably one of the hardest part. But, you know, people who really want to go on this program find a way to do it, and there are things that we sort of help them do. But fundraising obviously is one of the most difficult things.
Mm-hmm. And a key aspect of it. We'll
Absolutely.
go back to our feed and see if we have any more comments. Let's see here. There's a comment here from Julie Parker. She says, "I love Janet." That was the chef you were talking about.
That's right.
And Asari Isaac says that GMR is an empire. Denise says that I'm an X-ray technologist, but my trade was not needed. I worked in the pharmacy, peds, doing malaria testing, and helped with some of the dentistry. There really is something for everyone to do. So thank you for that valuable feedback for anyone who was wondering what they would be doing. So Dr. Wuzu has told us that there's going to be lots of work to be done. So for those of us who look for things to do to help the improvement of humanity, this is a great program. I'm sure if you needed even like community service hours for college students, this would be a great opportunity for you to do. And I'm sure that the organization would give you a detailed letter explaining what you did. For those of us who are going into different fields, you know, community service, community health, public health, these are all great things that you can use to get experience and also get to visit beautiful Ghana. So we're going to take a commercial break, and we'll be right back with our closing remarks. Thank you so much for staying tuned. We'll be right back.
Mm-hmm.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Welcome
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you very much for staying tuned with us. It's been a wonderful program. I hope for people who have tuned in, please share it on your news feed so other people will be able to see it later on. Abigail says that this is awesome. Julie Parker is watching us. Charles says, good work done. I got my bad tooth pulled in 2018. This is Charles' sister, Julie's son from Ghana. Oh, wonderful. I'm so happy you were able to get that service. And Belinda says, Dr. Eunice Cromwell, you are such a good interviewer. Thank you, and God bless you for tuning in. So we're going to go ahead and wrap it up. Today has been just such a wonderful show. Charles says that good work done. Oh, we already read his comment. Okay, so today has been a wonderful show. It's always so refreshing and so enlightening to know the things that we are doing back home. One thing I do want to ask you, Dr. Owusu, because we've seen on a lot of social media things that people are saying fix the country. Some people are saying fix themselves. So June is actually a month that I'm dedicating just for healthcare in Ghana, actually. I'll be speaking to a lot of different aspects. We had our president of Ghana National Council who gave us his personal experience in Ghana when he was there in terms of healthcare. So as a provider who works here and as a provider who is committed and dedicated to the progression of healthcare in Ghana, when you hear fix the country or fix the self, what does that mean to you as a healthcare provider? Someone who is definitely taking steps and really doing things to fix healthcare. What does that mean to you? What does that whole protest, I should say, or that whole campaign mean to you?
Yeah, obviously that statement has several meanings, and for us in healthcare, I think what people are asking for is an opportunity to live better lives. I think what people are asking for is better access to healthcare. I think what people are asking for is a system where when you have an emergency, you can call for help and get the help that you need. So this has different meanings to different people. It's not that easy to fix anything, especially when you talk about systems. I mean, the healthcare system in Ghana has been in place for many decades, and there's not a switch to turn it on and off and to sort of get things to change. It will take some time. But the most important thing about anything is to keep making gradual steps. What we have to do is sort of stop making the same mistakes. What we have to do is sort of create programs that we know are sustainable. What we have to do is find out what people really need instead of what we think they'll benefit from. And those are some of the things that we do at GMR. So, example, I was telling you, what we do at GMR is before we go to any community, we spend time looking at that community, look at some of the surrounding villages, look at what is it that they will need, and then we try to implement, come to that community with programs that we think will be beneficial to them. But we don't just do that in a vacuum. We talk to community leaders. We are fortunate to have healthcare providers in Ghana who will look at that. For instance, this year, in order for us to just run a clinic in Kwewu, we've had some of our Ghana liaisons, Dr. Anson, who's a urologist, he's made multiple visits to Kwewu. He's visited Kwewu Hospital several times. He's working diligently with the chief medical officer in Kwewu because we want to know what they need and not what we think they need. And so when we get there, whatever we do and how we run our clinics should complement what they are already doing. Okay, and that's what it is. We don't want to waste time on repetitive things that end us nowhere. Okay, we want to make and so that's what it takes to make a difference, and that's what it takes to change, the paradigm. And so, we sort of have to, as the Americans say, think us out of the box and not keep making the same mistakes over and over and keep, implementing the same failed tactics. And so we need something different. And I think that's what people, when you hear people talking about fix the country, they're talking about, making substantial change, mandates. Change has to be significant or else it's not worth anybody's time. So I think that's what people are asking for.
Absolutely. And from what you're saying, to you, fix the country is everyone working together. As you said, that how they're going to go to the clinic. So everyone working together to make a difference. And that is what we truly also believe here at Trend Africa TV as well. Mr. Johnny Wood says, Dr. Owusu, do you get security to protect everyone during the duration of time that you're in Ghana?
Well, we don't have any kind of formal security. We just we just believe in good faith. I think that, for those of us who are out there and committed to doing the right thing, we hope we've never had any problems with that. We obviously, we sort of make sure that our volunteers are safe as best as we can, but we believe in good faith, and Ghana is a relatively safe country. Usually, when you hear of when you hear of some of these events, they are not in Ghana. So I'm comfortable. We're comfortable with where we take our volunteers, and we're comfortable with where we run our programs. And if we at any time feel that some form of security is needed, we certainly know what to do. But we do things in groups. We try to keep everybody in the same group. We try to do things together and not sort of get there and let people run rampant and get themselves in trouble. And I think that when you run such programs, if you can always keep people under the same umbrella, security usually doesn't become much of an issue.
Absolutely. And if you go on their website, they also talk extensively about things that you need to get done prior to going to Ghana. I know during our Health and Wellness Expo, I spoke at that at length, different immunizations that will protect you while you're in Ghana, different things you can do for prophylactics against malaria and all those things. So those things are all well considered and all thought of because, again, the founder of it is a physician himself, and he doesn't want to take anyone there and end up getting sick. So those are things that are very well thought of.
Yeah, absolutely. Your health is very important to us. I mean, we always say that safety, your health is first. You cannot make a difference in people's lives health-wise if you show up there and you're ill. So, we make sure people have vaccinations. When we go to Ghana, we provide drinking water and other things like that. And that's why we are fortunate enough to have our own chef. So all those things are taken care of to ensure that you are safe and healthy. So we can actually put you to work. So that's the goal. Exactly. So the safety is important to us, but we want to make sure you're safe. We want you to make sure that you return safely to your family here in the U.S.
Exactly. Wonderful, wonderful. Mr. Johnny Woods says, great job and thank you. Thank you, Mr. Woods, for joining us and all your wonderful feedback. We truly appreciate it. And he says his donation is on its way. Thank you.
Well, thank you.
Thank you. We received it early. Thank you so much. We're going to go ahead and wrap up. It's been such a pleasure to have you with us today.
Thank you.
Dr.
Thank you. You've been great.
Once before you talked about women's health, and today we're just blessed to hear all about GMR, and we are all excited. We are all going to get our donations ready so we can be able to support your mission, Ghana's mission, I should say, everyone's mission, because this is something that's very, very important to everyone. So I'll just go ahead and give you the time to go ahead and give your closing remarks to our viewers. If my producer can just go ahead and put where people can donate money again, that would be helpful. And then remember, guys, you can also go to GoFundMe. Also go ahead and check out their website. I believe they're also on Instagram and Facebook, so you can stay up to date with everything they're doing. And if you have time and if you're willing to go, definitely join them in August to join their medical mission, which is going to be massive and very, very life-changing for everyone. So, Dr. Wusu.
So thank you for the opportunity to be on your show. Once again, I think that you're providing, you two are providing a wonderful service to Ghana and to Africans abroad. So thank you for that opportunity. I think that, what we have at GMR is very important. I think it makes a difference. I am convinced that we are changing lives, and that's why we want to keep doing this. I think all of us, sometimes, and those of us in healthcare, actually, we got interested in healthcare because we are committed to sort of providing, not just providing healthcare to people, but making their lives better. And I think those of us who do this every day understand one thing. We sort of have to find a way to make our lives become a blessing unto others. And so if the notion here is not just to care for yourself and your family, but the notion here is to extend the arm outside your home. And programs like GMR give you the opportunity to do so. Scripture tells us that we are the lucky ones, and for whom much is given, much is expected. And this is how we do that. So yes, I don't expect everyone to be able to join GMR, but I think you can support the members and the team, and you can also support, some of the programs that we are doing. And I think in doing so, not only would you have done God's work, but you also would have made a difference in your own life, and you have made a difference in the community that you live in. So we welcome your donations, we welcome your participations, we welcome your blessings, and we ask that you continue to pray for us in all these missions and and on all our journeys, so that we sort of be able to continue to do what we're doing. Our goal is providing healthcare one village at a time, but even beyond that, our goal is making a difference in people's lives, and that is what we stand for. So thank you.
Absolutely. Thank you. And that was Dr. Owusu. We are very, very happy that he was able to join us today. I will end with just saying that Ghana Medical Relief is thankful to all who are considering joining them for this medical mission, whether you're going to come there in person or give a donation. Remember, they are a non-for-profit organization that is providing free healthcare services to underprivileged villages in Ghana. Volunteers are given this opportunity to travel abroad and work alongside local medical professionals, engaging in multiple beneficial learning exchanges while providing valuable support to hospitals and clinics within the local communities. We all have something that we can do to give back. Be part of the solution, donate, or volunteer and actively help. Until next time, my name is Dr. Cromwell. God bless you all, and God bless our homeland, Ghana. Thank you. My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Spiritually, finally, everything is working for me. Finally, cause I got the favor of God over me. Everything is working for me. Finally, cause I got the favor of God over me. Though I don't deserve, oh yo, it's working in my favor. Though I don't deserve, oh yo, it's working in my favor. If I say I have to calculate to you or speculate to you, His promises don't fluctuate to you or palpitate to you. His blessings just be flowing out, down on me. His favor just be flowing out, down on me. No need to rush in life cause the race is set for me. Run for me, one for me. I know be sweet by God where you favor me. No need to rush in life cause the race is set for me. Run for me, one for me. I know be sweet by God where you favor me. Everything is working for me. Finally, cause I got the favor of God over me. Everything is working for me. Finally, cause I got the favor of God over me. Though I don't deserve, oh yo, it's working in my favor. Though I don't deserve, oh yo, it's working in my favor. So as you see me dancing, favor, amen. I dey count my money, favor, amen. As I dey drive Bugatti, favor, amen. When the song hit you, favor, amen. Let me hear your amen, amen.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa